Hot flashes, mood swings, brain fog. What is going on? If you've ever wondered whether or not you're in menopause, and if it's sneaking up on you sooner than you expect, you're not alone. Let's break it all down. What's happening? Why is this happening? And how to handle it. Stick around because we're going to get deep into symptoms, solutions, and things that no one talks about. I'm Dr. Jen, board certified integrative medicine doctor, OBGYN, and also medical advisor for Physician's Choice. So when does menopause happen? Most think that menopause actually occurs at age 50, but believe it or not, you can actually experience perimenopause between 4 and 10 years prior to menopause. So guess what? That can be actually in your 30s. So your body doesn't just say, okay, today's the day. You actually have symptoms that develop over that 4 to 10 year time frame. So let's talk about, is this normal? Let's dive into what is actually happening. What causes menopause really? Well, menopause happens when your ovaries stop producing estrogen and progesterone. It's totally natural, but these symptoms develop. This shifts everything from your sleep to your mood to even your gut health. So when you're younger, your brain is actually sending a signal to your ovaries, please make hormones, make estrogen, progesterone, testosterone. This is synchronized and this leads to a 28-day cycle. When we're born, we're also born with all of our eggs at that time. And it is a set time to when we run out of those eggs. And everybody can be very different with this. No one has the exact same time. And when that signal happens that there are really no more eggs or really follicles, then your ovaries say, well, I don't need to make any more hormones. But the brain continues to ask the ovaries, please make hormones, please make hormones. But the ovaries say, you know what? Nope, it's done. We're not doing it. We don't have any follicles to develop. We don't have any eggs we want to nurture. And so because the brain keeps asking and asking for the ovaries to make hormone, we see our FSH level rise. And FSH again is follicle stimulating hormone. And that's the signal that was telling the ovaries what to do. Hence, your doctor may check an FSH level if they're not sure if you're in menopause or not. So if you've had a hysterectomy or an ablation and you really don't have any periods to go off of, your doctor may check an FSH level. And if FSH level that is over 30 repetitively, so you've had it more than once on a different month, or you've had 12 months consecutive with no periods, that indicates that you are in menopause. The age range can be different, right? So if you're experiencing perimenopause symptoms in your late 30s, you might actually go through menopause in your late 40s. And it can creep into as early 30s. There are women who go through menopause at 45. So therefore, they actually start experiencing symptoms in their mid-30s. But it's a transition. And so this is what I want to talk about specifically about what are the symptoms that you experience if you think you're in perimenopause. So some of the symptoms, and this is not all of them, believe it or not, there are over 80 symptoms associated with perimenopause. But the most common ones are irregular periods, hot flashes, night sweats, vaginal dryness, sleep problems, can't get to sleep, can't stay asleep, brain fog, low libido, weight gain, and some lesser known ones like ringing in the ears, itchy ears, changes in your dental health. If you're interested in that, I actually made a video that was called Lesser Known Symptoms of Perimenopause, and you can check that out on my YouTube channel. So let's talk specifically about sex health. So believe it or not, menopause does make a big impact on sex health. And it's complicated because it's not just hot flashes and night sweats and vaginal dryness that make intimacy a struggle. Some women kind of feel like things are dead down there, like it's really just no sensation, and really it's real. And that's because that lack of hormone causes less blood flow to that area, so you feel less sensation. But it's not the end of your sex life. There are solutions that are hormone therapy, non-hormonal therapy, and even lifestyle changes that can help. Menopause also affects your gut and your gut health. I know this is something that not a lot of people know about or even talk about, but believe it or not, your gut and your hormones are best friends. When estrogen drops, your gut microbiome shifts, leading to bloating, weight gain, and digestive issues. And it's important that we pay attention to gut health as we age, because if we improve our gut health, we will overall help every perimenopause and menopause symptom. So lastly, let's kind of go back to what we were talking about before. And since perimenopause lasts 4 to 10 years, and menopause is the day that you have had 1 year without a period, or you have those FSHs that are drawn a month apart. On average, most women live a third of their life in postmenopause. And this increases their risk for things like osteoporosis, cardiovascular disease, and cognitive decline due to low estrogen levels. So your body continues adjusting. And so we want to talk about what can you do to feel like yourself again. It's so important that you know that you're in control of your health and you're the one that can determine how you age gracefully. So some of the solutions that can help, and again, this is just a little part of it, and I really encourage you to talk to your provider about all the different options because your journey is your own personal journey. And I often use many things in my menopause toolkit to help women get through and to thrive. So nutrition is incredibly important. You really want to think about fiber, healthy fats, hydration, getting adequate protein. There's a lot of things you can do to tweak your nutrition. Exercise, you really want to focus on strength training and cardio, but strength training for sure because you lose muscle mass every year and you want to make sure you're gaining that muscle back. Sleep, man, that is the most undervalued thing. Sleep. Magnesium is very helpful for sleep, making sure you have a cool, calm place, dark bedroom to sleep. Lots of good sleep hacks. And then hormone replacement therapy is definitely beneficial for women, and you should talk to your physician if you're the right candidate. One other thing to mention, there are definitely some smart supplements, things like probiotics, omega-3, fiber, and many, many more. And I don't have time in this video to talk about it, but I have talked about the top 5 supplements for menopause that I think are crucial. And lastly, stress management. Everybody talks about stress management, but we all don't do it, including me. So it's really, really important that you think about ways to calm yourself and to make sure that you're having stress-free days. Menopause isn't the end, it's just a new chapter. If you want to feel better and take control, then leave us some comments and I'm happy to share experiences that I have with my patients that I can help you. Thank you.